When it comes to age-related macular degeneration, in terms of all the causes of permanent vision loss or blindness, macular degeneration is number 4 worldwide. And in 2020, roughly, there were 200 million patients with age-related macular degeneration, and that number, due to our aging population, is expected to shoot up to 300 million over the next 20 years. So we have a very, very large population of patients worldwide burdened by a disease that can really disable them. And so when we think about macular degeneration, we think of it in sort of 2 phenotypes. The most common type is called dry or non-exudative age-related macular degeneration. And in that disease, the retinal pigment epithelium, the cells that are underneath the photoreceptors of the macula, the center part of the retina that processes our central vision, those retinal pigment epithelium cells become engorged with deposits of protein and fat. And that process can lead to atrophy or loss of cells, and then ultimately loss of function in the vision. That's the majority of patients that have macular degeneration, that they have the dry form. And there's a spectrum. There's some patients that have very minimal visual change or no visual change, and there are a proportion of patients that have advanced vision loss. When it comes to the other form, wet macular or exudative macular degeneration, that's about 15% of patients in general in that population that develop this condition. In that condition, aberrant blood vessels, we call them choroidal neovascular membranes. So they arise typically from the choroid, the layer of blood vessels underneath the macula. And these membranes are not normal. They're neovascular. They grow spontaneously like tumorous growths, and they leak and bleed underneath and within the retina. And that process can cause rapid and sometimes permanent damage to the photoreceptors, the ganglion cells, the connective tissue cells within the retinal architecture, the macular architecture, and can lead to severe and rapid vision loss in these patients without treatment.